Well, good afternoon, everyone. Welcome to the 55 Plus Driver Safety Program Pop-Up Symposium for Raging Aging. Today, we have a presentation, and our presenter is Kim Franklin. She currently holds a master's degree in health administration from the University of Cincinnati. She is currently a program manager for the Georgia chapter of the Alzheimer's Association. Kim has been with the chapter since July of 2006. She is responsible for overseeing programs and outreach in the state of Georgia. She has trained several thousand professional and family caregivers statewide through in-services, conferences, and full-day trainings about providing care for individuals with Alzheimer's and related dementias. I'm going to turn it over to Kim. Welcome and thank you very much for taking time out to present this program to our listeners.
Thank you, Jim. And as Jim said, I do a lot of training throughout the state for family caregivers, professional caregivers, and we also do a lot of law enforcement training in our state too, to educate them about Alzheimer's disease and then various resources in the state for when they do come into contact with individuals with this disease. The first part of this training is going to be just kind of an introduction to the disease, and then I'm going to go into more details about some of those resources and issues with driving and wandering and things like that that we typically come across. So as Jim said, you guys are welcome to use the chat function, and if people want to stop me and ask questions throughout, I'm completely fine with that. I cannot see you guys while I'm in the presentation mode, so please, again, feel free to stop me or just type it in the chat, and Jim or somebody can stop me as we go as well. So like I said, we're just going to do a little brief introduction to Alzheimer's disease to give you guys a little bit more knowledge about the disease itself, and just understand a little bit more about what the individuals actually are going through when they have a diagnosis of Alzheimer's or some other form of dementia. Let's see. So first, we're going to talk a little bit about what normal aging is versus dementia, because a lot of times people don't understand the differences between the two. We're going to take a look at what Alzheimer's and dementia is, and then we'll talk about some of the risk factors that we currently know to be an issue for long-term development of Alzheimer's or another form of dementia.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
So as he said, Alzheimer's disease is more than just memory loss. It's going to be a progressive and fatal disease that it's killing nerve cells in the brain, which is affecting the individual's ability to remember things, think properly, plan, and ultimately really function long term. In this next video clip, we're going to hear the difference between Alzheimer's and dementia. And an easy way that I like to explain this is it's like if you hear the word cancer. Cancer is that main word, so dementia would be the main word there. Alzheimer's disease is the most common form of dementia. So like with the word cancer, we know there's a lot of different kinds of cancer that exist out there. So again, Alzheimer's is that dementia is that the main word. Alzheimer's is the most common form of dementia that exists. So they say it accounts for about 70% of all dementia cases. So again, it's the one that we hear of the most often, that most people are the most familiar with. They do estimate that there's over 70 different forms of dementia that exist out there. Most of them, the hallmark of it is going to be the memory loss. And then some of them have some other issues that go along with it, like more behavior issues, paranoia, things like that, that we see that are common with some as well.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So as Dr. Snyder explained, a diagnosis of dementia is really an incomplete diagnosis because it is that umbrella term that's used to describe a person's changes in memory. So really more investigation would be necessary to figure out really what kind of dementia the person is suffering from. There's also reversible causes of dementia, urinary tract infections. It could be other medical conditions, maybe medication interactions. So that's why we always urge an individual to go to a specialist to get more of a thorough diagnosis in that process as well. So all of us have brains, which means all of us are at risk for developing Alzheimer's disease or another form of dementia. So we don't really know the exact causes of the disease at this point in time, but we know that as a person ages, that their risk factors can increase. And in this next video, we're going to hear a little bit more about that.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
Oh, let me go back. Okay, so as she discussed, we do see some populations that are at higher risk. We know that Hispanics, African American, and women are at a higher risk for Alzheimer's disease. Research shows that older Hispanics are about 1.5 times as likely as older whites to develop Alzheimer's and other dementias, while older African Americans are about twice as likely to develop the disease as older whites. The reason for these differences is not really well understood at this point in time, but research does suggest that it could be because there's higher vascular rates of vascular disease in these individuals, which also could be putting them at greater risk for developing Alzheimer's disease. We do see a correlation between anything that is vascular related or diabetes as well. So we just really urge individuals to monitor their numbers and keep those things in check, those other conditions in check by medication management or whatever is suggested that they do. We also know that women are at greater risk for developing Alzheimer's disease than men at this point in time. And we used to say it was because women outlived men, which increases our risk for developing Alzheimer's disease. But at this point in time, they also think that there may be some genetic risk factors in the differences in the makeup of men and women, which are putting women at greater risk. So they're doing a lot more research around that at this point in time. So let's take a minute to test our knowledge here. And I guess you guys are going to have to unmute or type it in the chat. But this first question is, True or false question. Alzheimer's is a normal part of the aging process. Do you guys believe that's true or false? Based on what we've covered. Oh, I see the chat going up. Hold on, let me cook. Okay, I'm seeing no and a lot of falses, which is correct. As we talked about, this is not normal aging. This is a disease of the brain. It is a fatal disease, unfortunately, at this point in time. And we do see that it causes problems in memory, thinking, and behavior. So again, it is not a part of the normal aging process. We know that as we age, our bodies start to change, things start slowing down. We might not jump out of bed like we once did as quickly in the morning. We might not move as quickly first thing in the day or late in the day. But as our bodies start slowing down as we age, our brain also changes as we age too. So we do find that you do see that as the body ages, the brain ages too. So we don't remember things like we once did. Brains start to actually shrink down in size as we age. So that would be considered normal aging, some loss of memory, maybe not remembering all your groceries like you once did when you get to the grocery store without taking your list. But obviously more complex issues that we're going to talk about would be considered not normal aging as things progress and get worse as well. Does anybody have any questions before I talk about some of the warning signs with Alzheimer's disease? Okay. Here's another question. What is the greatest known risk factor for Alzheimer's disease? Is it genetics? Is it family history? Or is it age? You guys can unmute or type it into the chat if you'd like to again. I see genetics. I see age. Okay, and I'll go through each of these. So genetics is actually, it does increase your risk, but it's not the greatest known risk factor at this point in time. And interesting, they used to do a lot of research around genetics and family history, but now they're actually looking at other causes for the disease too. But those of you that said age are correct. Like I just said, it's not part of that normal aging process, but age is the greatest known risk factor. After the age of 65, our risk for developing Alzheimer's disease doubles every 5 years. And 32% of people age 85 and older have Alzheimer's or some other form of dementia. So again, as we age, our risk does increase. Genetics, family history can put us at higher risks, but the greatest known risk factor would be considered age. All right, so next we're going to go through these 10 warning signs of Alzheimer's disease so that we have a better idea of what to be on the lookout for. And again, there is what we call normal aging, and then there's what we would be considered not normal aging and more things to be considered that need to be investigated further by a doctor. So of the first warning signs, and I don't know why it's taking so long for these to pop up. Hopefully they'll pop up as we go through them though, is memory loss that disrupts daily life. So again, this is going to be more than just forgetting something at the grocery store. It's going to be maybe forgetting recently learned information. So you guys just sat on this webinar, you get off and you can't remember any of the information that I shared. That might be concerning for some of us. The second is challenges in planning or solving problems. So in this one, keeping track of monthly bills might be an issue. And maybe some of us have always had trouble doing that, so it might not be concerning if we continue to do that. But if you've been somebody that's always kept up with the finances, stayed on top of paying things on time, and now all of a sudden you have trouble keeping track of those bills, or not getting paid, you're paying some of them multiple times because you forget you've paid them, obviously that would be a cause for concern. The third one is difficulty completing familiar tasks. Driving would be considered one of these. You drive to the grocery store or you drive to your favorite place to eat, and all of a sudden you can't remember how to get home. That would be another concern. Confusion with time or place. So we know these individuals have more long-term memory than they do short-term memory. So a lot of times they're talking about or living in the past, looking for things from the past, maybe a home they once lived in. So the places they live currently would be not familiar to them anymore. Again, they may still refer to their parents being alive because again, they're living so much further into the past that they forget that their parents have passed away or that they don't live with their parents anymore. Trouble understanding visual images and spatial relationships. Vision is also affected by this disease. So judging distance while driving might become an issue. Also, color contrast can be an issue as well. So if there's like a black mat on the floor and they won't step on the mat because to them it looks like a hole. We also see that they have some depth perception issues with the disease. And also as the disease progresses, they lose their peripheral vision. So I'm looking straight ahead, putting my hands back and forth, and I can see them moving here to the side. These individuals lose this range of vision, and they actually say that as the disease progresses, that it moves further and further in so that they end up with almost like just tunnel vision to be able to see what's directly in front of them. New problems with words and speaking or writing. Word finding becomes difficult. They might start making up words for things because they can't come up with the proper word for an item anymore. Misplacing things and losing the ability to retrace their steps. And a lot of times this is one that most of us are familiar with, where we walk into a room at home and we can't remember what we walked in that room for. But most of us have the ability to walk back out of that room. And at some point in time, we're going to remember what it was we were doing. Oh, that's right. I was going to get the laundry, to take the laundry downstairs. These individuals do not have that ability to walk out of that room and remember what it was they were doing. Decreased or poor judgment. Again, I'm going to refer to driving here. At some point during this disease process, driving probably becomes a big safety issue. But these individuals don't understand that they have any impaired judgment. So they may still try to do things like that. We have some that haven't driven in years, and all of a sudden they get up one morning, and if they have access to that car, they'll get in that car and try to drive somewhere. And again, we're going to talk more in depth about some of the issues around driving and safety. Withdrawal from work or social activities and changes in mood and personality. And I usually loop these two together because again, as the disease starts to progress, they start withdrawing socially from activities. So if you have someone that still goes to church every Sunday, they're very involved in some civic groups and things like that, and they start withdrawing from those things, it would be a big red flag. We also see a lot of mood and personality changes as the disease starts to progress. If you've got someone that's always been very friendly, well-mannered, and now all of a sudden, you can't talk to them without them becoming very agitated and upset. Agitation becomes very common. That's usually a big red flag as well. So those are our 10 warning signs at this point in time. Some individuals may experience several of these signs. Some individuals may just experience one or two of them. So it's not necessary to experience all 10 of these signs to really have a concern about your memory. If you notice any of these signs in yourself or a loved one, we always just recommend that you see a doctor. And as part of the Medicare annual wellness exam now, everybody is able to get a free memory screening every year with that new annual wellness plan. I do find that a lot of people have to ask for it. So when you see your primary care doctor for your yearly physical or whatnot, asking for that annual wellness memory screening would be important because again, it just creates that baseline for the physician so that they can tell next year if there's some more concerns. We also tell family members, write things down so that if you get to the doctor and you can't remember what it was you wanted to talk to the doctor about, you've got a log of some of the concerns that you yourself have been having or your loved one's been having, just so that you can go through those concerns with the doctor. Again, it creates that baseline, and it also gives some background on some things that could be going on. And again, it's not always Alzheimer's disease or another form of dementia, so it's just important to rule out other medical conditions as well. Again, it's possible that individuals experience one or more of those varying degrees of those signs we went through. You don't have to experience every single one of those 10 warning signs. And again, if you want more information on the warning signs or what to do if you are experiencing or noticing some of these in yourself or a loved one, you can visit our website at alz.org for more information on all of this as well.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
So getting information and support is a critical next step for individuals facing Alzheimer's disease. And we want people to turn to us for information and referrals so that we can help families throughout the journey of this process. I'm going to play a few of our key resources that we have, and then I'm going to switch PowerPoints to go into our safety PowerPoint and talk a little bit more about wandering and driving.
I've had a couple of phone calls that I've been able to make in to the call center. When I've had a couple of quick questions that I wanted to ask, you know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
And as he said, that number is 24/7. It's for families, it's for caregivers, it's for the person themselves that's going through the disease. And a lot of times people say that it's their lifeline when they have an emergency or need some information or just need support on the other end of that phone. You will get a live person that's a trained counselor 24/7. So if you guys yourself know of anybody that's going through this, please give them that 800 number as a tool so that they've always got access to that.
When I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found a support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And finally, in communities nationwide, we have our community resource finder, which you can access through our website as well. And that's how you get more information about if you're looking for placement options, if you're looking for adult day services, in-home care, any of that information would be accessible right there. I am going to stop sharing my screen for a second. Does anybody have any questions for me while I get the next PowerPoint up and running? Okay, don't see any.
If you have a question or would like to, you can use the icons at the bottom of your screen to raise your hand, or you can just unmute and ask your question.
And are we good? You can see my PowerPoint again?
Yes, we can.
All right, excellent. Okay, so as I mentioned, we do a lot of education for first responders as part of what we do, just to educate them on some of the safety concerns like wandering, which can happen on foot, driving, and all of those things that can happen and that do happen quite often. And unfortunately with wandering, it's just something that we really can't plan for. It can happen at all different stages of the disease. And I should mention that we break the disease process down into 3 stages: the beginning, which would be early beginning, middle, and end. You may see some scales that break it down even further, but at the Alzheimer's Association, we do keep it in those 3 stages. But it is difficult because when you've met one person with Alzheimer's disease, you've met one person. So this disease affects everybody differently. So unfortunately, I can't say that, it's no longer safe for somebody to drive once they get into that middle stage, because that's not true for all people. So again, if you have questions or concerns, you can always reach out to our helpline so that we can help to kind of figure out the process where your loved one might be, and also having those conversations with the doctor is going to be key as well. So some of the situations that we've run into, and these have all been local situations that we've had over the years, but a man with dementia left his home by car at 9 a.m. to go to the store in his local neighborhood. 7 hours later, he ran over a curb in a Good Samaritan's yard 4 counties away. Then we had an elderly woman with Alzheimer's who wandered out of her home while her husband was in the other room in April of 2004, and her remains were found on Christmas Eve 2004, only 500 yards from her home. A lot of you may be familiar with the Maddie's call that we have here in the state of Georgia. That second situation is Maddie Moore, and that situation did result in some positive, because we did get the Maddie's call passed here in our state, which I'll go through that protocol and explain a little bit more about what that protocol does for us here too. So we know that Alzheimer's is a community problem, and especially when that person goes missing. The searches can be exhaustive, they can be very expensive, and unfortunately, they don't always result in a positive one. We don't always get that person back home safe. Oftentimes, we have to get law enforcement intervention in these situations. So we want law enforcement and you guys to be aware of have the proper knowledge and resources for a successful intervention and or search. And again, we are your partner when it comes to keeping this vulnerable population safe within our communities. And I talked already about some of our key resources, but we do want to be a community partner, especially when we have situations with a missing person. We also know that if the person is missing, is not located within 24 hours, that there's a 46% chance that that individual will be found seriously injured or even dead. So time is of the essence here, and we really try to educate families that if your loved one goes missing, to make sure you call for outside help, call 911 right away, just because the more time that goes by, the further away they can get, the more that can really go wrong. And if they're driving, obviously they can get even further faster. And a lot of times families, unfortunately, wait to see if the person will come back home, but we don't want a lot of time to go by, because again, they can just get further away. Wandering is the most common behavior that's associated with the disease. And I already mentioned that we really can't plan for it. So it's very difficult for families, because it's something we always just want to be aware of and think about. The average distance that person goes on foot is about a half a mile, and a majority of these individuals are actually repeat wanderers. So it's like once the behavior starts, it will typically continue throughout the course of the disease. So why are they wandering? Restlessness. I mentioned they live more in that long-term memory. So they're thinking they have to get up and go to work still in the morning, or that they still have to take kids to school or pick kids up from places. Confusion about time or place, again, living in that long-term memory. So they're looking for old homes or old places they used to frequently go. Maybe there's been a change in their home environment. So they might have been moved into a facility or moved into a daughter or son's house to live now. And so they're really confused within their new environment. So they're always looking for something familiar to them. They're trying to go home. And a lot of times you hear them say, I want to go home. I want to go home. And that place they live could be where they've lived the past 10 or 15 years. But again, they're looking for something from the past, something from beyond that. Overstimulation can be another issue. So think about how crowded stores are, grocery stores, how noisy they can be, or around the holidays, we have all our family and friends come over, and it can be overstimulating for them. So again, they're trying to get away from those kind of things and get somewhere they feel safe. Argument with a caregiver. Caregivers don't always realize that their reality is their reality. So when they tell you, I got to get up and go to work in the morning, and you say, Mom, you don't work anymore. You've been retired for 20 years. All that does is cause them more confusion and agitation, because they truly do believe the things that they're telling you, because again, they're in that long-term memory. And then fear caused by a delusion or a hallucination. Again, paranoia can be a big issue for some of these individuals. So they may see things that aren't really there, or talk to people that aren't there, and have some issues around hallucinations. They might not be able to communicate their basic needs to us anymore. So if they're hungry or thirsty, and so they just get up to go try to find food or water on their own. Went to the mailbox and could not find their way home. That mailbox could be a short walk to the end of the driveway, and they turn around and nothing looks familiar to them anymore. And that's when we've had some that have entered other people's homes and things like that, just because they get a little turned around. Again, from that long-term memory, looking for a spouse or child, because they no longer look familiar. So again, think long-term that they might be talking about us like we're still little kids, but yet we're grown adults. And a desire to meet those former obligations. So I mentioned work and things that they typically did throughout their lives. So things that we always tell families to think about, where did they live in the past? Because they might be trying to get back to that place, what their job was in the past. An example of this, a few years ago, we had a guy that drove off. He was following his wife, actually, and they'd gone to pick up one of their cars, and she told him, stay behind me the entire way home. All of a sudden, she looks up and he's not there. Well, when they'd gone over the bridge at Highway 20, he got on the highway and started driving. Well, this guy apparently had been a semi-truck driver throughout his life. So he was found at a truck stop somewhere near Alabama. So again, if we think about things that they commonly did throughout their lives, that job they held, we might be able to figure out where they're trying to go, or where they're trying to get back to. What was their maiden name? Again, think long-term. So things that they might respond to. I may not realize that I'm married now, so I may think that my last name is what it was when I was much younger. Do you have a recent photo of the person? Making sure that you keep a recent photograph of that person, because this disease can also change people and age people a lot quicker. So we want to make sure we always keep a recent photograph for search and rescue as well, if we ever need it. And has that missing person with Alzheimer's disease or dementia been talking about anything that might help us figure out where they're trying to go or where they're trying to get back to? So some of the warning signs around driving and dementia, erratic driving with slow or poor traffic decisions, not really paying attention to the rules of the road anymore. Intoxicated-like behavior. I can't tell you how many times we've had law enforcement tell us they thought they had a drunk driver when they stopped the person, just because they'll be weaving in and out of lanes. They may not use blinkers and things like that when they're trying to turn. That inability to pull over safely. So maybe there's been an officer behind them for a while and they don't stop because they don't realize that person's back there. Lost or disoriented behavior. They might get really defensive or get really agitated as we start asking them questions about where they're going or where they're trying to get to. Vague answers that don't match the questions we're asking. They might not be able to answer any of our questions. Their destination, location, or route may not make sense. So they might start giving us landmarks that make absolutely no sense to the area we live in. Again, they think they're back in the past. So they may start referring to things that don't exist around us anymore. An unsteady gait. They may walk or stand with an intoxicated-like look as well. I talked about in the 10 warning signs that vision is affected by the disease. So again, they may have trouble walking properly or standing. no valid license, registration, or insurance. So sometimes these individuals haven't driven in years, so they might not have an updated license or registration on the car, and their insurance may have lapsed, but they don't realize that. So they still drive without those items. You know, a lot of times families will say, we're just not going to renew his license, or we're not going to renew the insurance. But remember, these individuals have memory impairment, so they're not going to remember that they need those things in place to be able to drive. And then difficulty determining the date, time, or year. A lot of times, if you ask them what year it is, they may, you know, refer back 30, 40 years ago. Asking who the president is another good one, because a lot of times they'll answer that from somewhere in the past too. So steps to take with driving and concerns about driving is with law enforcement, we tell them to ask additional questions to make an assessment of the driver's condition. Also, there is a driver reexamination form, and families can fill this out. And it can be anonymous too. You can get it through the Department of Driver Services website. You can fill it out in order to get the person re-examined. They'd have to take the road test again, but I will tell you, sometimes if they're having a good day, they may be able to pass that driving test again. So it just depends on, you know, what kind of day they're having. Making sure they get a safe transit home if they are stopped, and then interventions with caregivers that we recommend. A lot of times we tell families to get the doctor involved. You know, sometimes if the doctor writes on a prescription pad, you're not allowed to drive anymore, they'll listen to the doctor. It just depends on the person again. Controlling access to the car keys. I mentioned that just because they don't drive anymore doesn't mean they're not going to wake up one day and try to drive again. So making sure that they don't have access to the vehicle is key. If the vehicle is no longer needed because they don't need to be driving and they can't safely drive, we typically tell families to remove it from the home so they don't see it every day and obsess about it. Also disabling, you can disconnect the battery. We've had some though that can work their way around that, and they'll have the car towed and get back in it again. So just making sure you monitor that situation and that the person doesn't have access to the vehicle is typically the safest route. We also have a guide at the office that talks about ways that you can have the conversation with the individual when it's time to stop driving. It's called At the Crossroads, so you may be able to find it online too, but if any of you need access to that, I could definitely get you a copy of that too, so that you've got that in your toolbox too when it's time to discuss this issue with the individual. So recognizing someone with Alzheimer's disease, again, we got to look at the physical clues. Blank facial expressions, a lot of times, you know, there just may be no facial expression at all anymore. Inappropriate clothing. So they may be overdressed or underdressed for the weather conditions. You know, it might be really hot outside today and they've got on layers and layers of clothes, which you would know would be kind of a sign that something might not be right. Age, which, you know, most of the time we can go on age because it might be an older adult, but now we have younger onset Alzheimer's too, which is people in their late 40s, 50s, and early 60s. And we have seen an increase in these individuals. So you can't always just go based on age anymore. And I did mention an unsteady gait. So again, walking with like an intoxicated like look as well. Some of our psychological clues you may see: short-term memory loss, confusion, communication problems, that agitation that I mentioned in the last presentation where you can't ask them any questions because they just get so easily upset. So what do we do if we find a person and we don't know who they are, where they go? We've never seen this person in our neighborhood before. Obviously, calling for outside help would be good. So calling 911, they may need to be taken to the emergency room for evaluation if they, you know, could have issues with dehydration, things like that, if they've been out there a while. Adult Protective Services also has money available for temporary placement if we need access to that. And then the emergency contact for temporary placement, which is in the GAIN app, which is really more focused on law enforcement. But we can get access. It's the Georgia abuse and neglect and exploitation app, and you guys are all free to download that app. There's a code that's needed for law enforcement. So if we have any law enforcement and emergency personnel on here, I can get you that code so it'll unlock all the resources that emergency personnel need for that app as well. I'll mention tracking devices just because we have seen an increase in these coming out on the market as well. If you've got a frequent wanderer, there are these tracking devices out there that you can put on the individual just to monitor where they are. There's also tracking devices that can be put on the car so that if the person is still driving and something were to go wrong, the family sets up like a perimeter of where the person can drive to. So if you want the grocery store and the bank and the gas station and, you know, a few restaurants in the area on there, but then once they exit that area that's been set up on that tracking device, it would alert any of the emergency contacts on there. So any family or friends or whoever's on there to let them know they have driven outside of that area that's been set up. Same goes for some of the tracking devices that's worn on the person. The areas can be set up, and once they go outside that perimeter, then the family would be contacted. With the tracking devices, a lot of them, the person has to be living at home with a caregiver. There's a lot of different stipulations that have to be in place for the person to be appropriate for it. And there's a few counties that have a tracking device that's run through the county. Again, there are some stipulations that have to be followed for the person to be enrolled in those programs. But if anybody wants more information about that, again, that's something you can contact me after this program, and I'm happy to get you more information or find out if your county or city has access to that information or those tracking devices. So how to interact with a person with Alzheimer's, we want to approach from the front, introduce yourself, and explain why you're there. Remember, I mentioned that some of them end up with like tunnel vision, so they can only see what is in front of them. So we don't want to walk up from the sides or behind because it may startle them. Keep the individual away from crowds and noise. If there's a lot going on in the area, sometimes if you can pull them off to the side, they might be able to concentrate better and communicate with you and begin to start answering your questions. We want to establish one-on-one conversation and maintain eye contact. You might have to start asking really simple questions. You know, do you have family? Do you have kids? Are you married? Do you have pets? To start getting them thinking and get them to be able to answer some of your other questions. Sometimes we can get that simple information to kind of figure out what's going on, who they are, where they came from. Some of these individuals do go nonverbal though as a result of the disease process, so they may not be able to communicate with us at all anymore. We want to speak slowly and calmly and always tell the person what you're doing and explain it again as you're doing it. You guys did get access to the little pocket cards that they sent out to you. If you didn't get it, please type your information in the chat and we'll make sure you get it. But these are some evaluation questions that we can use to help determine if the person is lost or confused. We can tell them our name and tell them that you want them to remember it because you're going to ask them again in a few minutes. Then you want to ask the person what time of day it is and where they are. Again, typically they're going to have trouble answering a couple of these questions. And then after a few minutes, again, ask them what your name is. Remember, we're just asking them a few questions here, but because that short-term memory is affected by the disease, they're typically not going to retain what your name was, even though you told them to remember it. If the person cannot successfully answer those questions, we can try to obtain family information, search the vehicle if there is one, wallet, cell phones for any emergency contact information. And then also you can check the person's clothing, because if they're from a community, a facility, sometimes their name is in their clothing. Some families also have ordered those clothing tags to put in like emergency information in their clothing, things like that. And then again, call for outside help. We say take action immediately. I mentioned that sometimes a lot of time goes by before families report the person missing. And these individuals are considered endangered missing persons. We want to initiate a search. Search and rescue dogs work great if the person's missing on foot. Again, it's just something that we need to get access to and do in a timely manner, just because scent trails and things like that in the area could become contaminated as well. We want to enter a report into the NCIC, and that's the National Crime Information Center, and classify the person as having a disability. And then be on the lookout, issuing a BOLO, be on the lookout bulletin as well, to get the community's help in looking for them and being on the lookout for the individual. I mentioned Maddie Moore at the beginning. This was a very publicized missing person situation in the city of Atlanta. And at this point in time when Miss Maddie Moore went missing, they realized that there was emergency alerts in place for kids, but there was really nothing in place at that time for adults that had any cognitive or medical disabling condition. And so we pushed the state and got this thing passed, and it has brought home so many people over the years safe. And a lot of states, we were the second state to actually get a protocol in place like this, and a lot of other states have since developed their own emergency protocol as well. A lot of them are called silver alerts. Some other states have different names like we do, since it was named for Miss Maddie Moore. But what it is a formal protocol that notifies law enforcement agencies, emergency management, and the media to issue an urgent bulletin regarding a missing person with Alzheimer's, dementia, or any other cognitively disabling condition. So it is not just Alzheimer's and dementia specific. It is similar to the Levi's Call and Amber Alert, which is the alerts we have in place for kids, but the only difference is it is not through the emergency alert system. So it does not go on TV and interrupt the broadcasting that's happening, which those two Levi's Call and Amber Alerts will do. I mentioned how it was developed at the beginning of this session, but what it will do is it has 3 phases. The first phase is it issues an urgent bulletin through GBI, Georgia Bureau of Investigation, to the Georgia Association of Broadcasters, and this is where all the news networks and all those individuals will get it. The second phase is a child is missing telephone response system, and 1,000 calls go out in about 60 seconds to the local area, letting them know there is a missing person in the area. And then the final third phase is the Georgia lottery system. So anywhere lotteries sold in the state, you'll see the alert information scrolling on those lottery screens. And that's how we've gotten some drivers back home. Actually, we had one that was in South Georgia. A lady went in to pay for her gas, saw the description of the man's vehicle and information, and he was sitting in the gas station parking lot where she was getting gas. So again, it helps to get the public's help to get these individuals back home quickly and safe. Law enforcement are the ones that have to get the Maddie's Call implemented and put out. So again, we just really urge people to call for outside resources, call for outside help as soon as possible. With search and rescue, again, search dogs are sometimes necessary. It's a great resource for us as well, because a lot of times individuals with Alzheimer's and dementia are going to hide when they wander because they're scared. They don't know where they are. Again, remember, they're looking for things from the past that don't exist anymore. So they might get down in a ditch or a tight spot and lay down, dense bushes, piles of leaves. The search team that we work with a lot has said that the dogs sometimes will signal through really thick brush and briars, and it doesn't look like anybody's in them, but sure enough, the person's in there. And sometimes we think that they might get themselves into these situations. They can't get themselves back out of it once they get in there. We want to check landscape trouble spots like ponds, tree lines, fence lines. Some of them will start walking and they will go straight through or over anything that's within that straight path that they're on. Behind or inside of sheds, attics, basements, neighbors' houses, barricaded places and locked doors. If they're missing from a facility, making sure that facility gets rechecked thoroughly. And then the people that drive typically will drive until something stops them, whether it be they run out of gas, the car breaks down, and then unfortunately, a lot of them will get out of the car and go on foot from that location. Some of the urgency factors that we run into, weather becomes an issue. Urban areas, if they end up like in a downtown area that's really crowded or lots going on, they may blend in. Precipitating events, and these are things that we can find out from their caregivers or family members. Has anything big recently happened? You know, have car keys been taken away? Did they lose their job? Have they recently been moved to a new home? Because things like that can, you know, really rustle their feathers, so they have trouble really processing what's going on. Insufficient clothing or food, so they start losing calories and losing a lot of energy. A disruption in their medication schedule. You know, a lot of medications have to be given at a specific time or specific time of day. Also, a lot of medications that elderly people can be on can be extremely dehydrating. So time is of the essence with that too. Then if we're approaching darkness, we're running into late in the day when these individuals have issues around sundowning and things like that, which are just an increase in behavior because they have trouble processing really what's happening. They can see more things in shadows late in the day and things like that. I've already gone through some of our key resources, but again, you know, if any of you need more resources, more information, our website has a ton of information on it. The helpline is also a great number to call. We do care consultation, which is just more family counseling type things we can do with family. We offer education programs, more in-depth education than I've done here today, just on disease-specific things that we can do for free for any community organizations, churches, you know, professionals. So please reach out if you have any needs or need more information. We also have support groups all over the state that you can get access to through our website as well. Does anybody have any questions? And I'm going to stop sharing so that I can see as questions pop up.
If you do have, excuse me, if you do have a question, you can unmute yourself and just ask it. If you don't have a microphone or having technical issues, you can put it in the chat. And of course, you can always reach us via email.
Yeah, and I see Lila put in there too. If you are outside of Georgia, she put a state-by-state guide. Also, the Alzheimer's Association is nationwide. So any services that we offer here in Georgia, you can get in whatever state you're in as well. We have chapters all across the nation. So, you know, don't hesitate looking up your local chapter and reaching out because they do anything we do here.
And I'd like to point out that Kim is a member of our 55 Driver Safety Task Team, which is basically funded by the Governor's Office of Highway Safety for older drivers in the state of Georgia. We work on various projects. One of them is the task team, but we also do a program called Yellow Dot, which is for older drivers with a process that helps first responders in the event of a car crash. We have Car Fit, where we take a look at how your car fits you. And we have several other programs for traffic engineers. If you've gotten our advertisement for the Raging Aging pop-up symposium, you saw some of those projects that we're working on. And of course, you are all invited to get in contact with me. My email is in the chat. And if you have questions in the future, or if you'd like to join the task team or be involved in any one of the projects that we have going on, you're more than welcome to come on board. I'd also like to introduce Lila Ralston. She's on here somewhere. She is the program consultant, and she is also available for any projects that we have going on. So are there any other questions that you might have? I'm not seeing any hands.